So what are the signs of low estrogen? The typical ones that I might see in clinic are things like hot flushes, anxiety, brain fog, changes to the hair, thinning, weight gain, and then other things like vaginal dryness, pain on intercourse, so discomfort having sex, and loss of sex drive. So they're the key ones, and we'll go through a few of those in more detail. So the hot flushes are often described as, well, they can start in the head and the face, or they can start in the toes and move up the body. They're often described in different ways, but in America they call them flashes. And night sweats are the same sort of pathology, the same sort of process as well. And it's due to this up and down of the FSH hormone and the impact that has in the brain and on the way your body maintains its temperature. And it's due to the body trying to find estrogen. It affects about 3/4 of women, and it can persist for 5 to 10 years. And on average, it lasts about 7 years. The other common symptoms is anxiety and low mood and the brain fog. And again, this is most likely due to the lack of estrogen. And it's often seen more in ladies who've struggled with things like PMS, so premenstrual syndrome, or PMDD, or ladies who've had things like postnatal depression. So ladies that are very sensitive to the changes in hormones in sort of in the menstrual cycle or after delivery of a baby. But it can affect women that have never had those problems as well. And you lose the estrogen, and that there's probably a few things, the reasons anxiety and depression occur, but the mixture of the night sweats, the anxiety, not sleeping very well, feeling very tired, that's certainly going to make symptoms worse. And then there's certainly an impact in the brain as well. So lack of estrogen, the brain is very sensitive to estrogen. And we know that if we do brain scans in a lady before and after the menopause, there's a big difference in the blood flow and the activity of the cells in the brain. So you do get this reduction in activity in the brain. You get laydowns of proteins, so abnormal sort of waste product that gets laid down in the brain. And that also, in addition to the brain fog and things, probably causes dementia and other long diseases. The other common complaint is vaginal symptoms. Now these include dryness, soreness, and it affects about half of women going through the menopause, and it even affects about 25% of those who are already on HRT, so sort of HRT through the skin or that they take by mouth, so what we call systemic HRT. And so even women on systemic HRT need some vaginal estrogen. And the reason for this is that the estrogen levels drop. The cells that line the vagina, which are normally very plump and very stretchy and produce mucus, they no longer do that. They become very rigid, very thin, very dry. And this actually changes things like the bacteria, and can cause thrush infections. And the bladder and the bladder neck and the urethra, so the tube that connects the bladder out, also has estrogen receptors in, so it's also sensitive to estrogen. And the loss of that increases urine infections as well. And so when the vagina is also dry and not stretchy, sex can be uncomfortable, can cause bleeding, can cause bruising, and can even, at worst, cause tears. So vaginal estrogens are very good. They're thought to be very safe, even in women with a history of breast cancer, for example. And they can also affect young women. So ladies that are breastfeeding, because of what breastfeeding does to the hormones, that can cause vaginal dryness, and those who are on progesterone contraceptive as well. The other common complaint is about libido and sex drive. Libido is very complicated. It's not as easy as testosterone, as much as we'd like it to be. Testosterone can be very good, but there's many factors that make up libido, and these include things like the vaginal dryness. So if it hurts to have sex and you bleed when you have sex, you're not really going to want to have sex. If you've gained weight or you're having hot sweats, you might not feel as attractive as you used to. So that might affect your libido. If you're having hot sweats and you're not sleeping and you're anxious and you've got a low mood, then that will affect your libido. The other thing is life events. So I quite often sort of ask my patients, is there anything else in the background going on with your life that you're struggling with? Because, for example, elderly parents who aren't very well, going to care homes, children who are leaving home, relationship problems, work problems, all these things as well impact the desire to have sex, or libido as we call it. And the other thing is, do you, as well as feeling attractive, are you attracted to your partner still? So there's lots of factors at play, and then obviously testosterone. Now, not every lady has a drop in their libido through the menopause, and that's because the body makes other types of testosterone, weaker testosterone from other places, such as the adrenal glands, which are little glands that sit on top of the kidneys. And for some women, that's okay, and that's called DHEA. But for other women, it's not quite enough. So we need to replace it.